Hi, this is Lynn again. This is part 2 of the Spinal Fusion video. As I said in the first video, the first few days were quite painful and I had a really tough time at the hospital. The remaining days this week, every day really got a little bit better than the last, and definitely the 1 week mark is a big difference than where I was each day before. Can move around a lot better now than I was previously. One thing that did happen is I ended up, I don't know if you can see it or not, on my arm here, it got swollen and red and very painful. And I went in to see the doctor today to find out what was going on. And she said that I have a skin infection and sent me in for a sonogram to see if I have a blood clot. They did a sonogram of my arm and they did find what's called a superficial blood clot and superficial thrombophlebitis or something along those lines, which means that it's not like the deep vein thrombosis where it's the blood clot's really deep in your vein and then you have to worry about it breaking off and getting into your lungs. This is in a superficial vein. So it's not as serious, but it's still quite painful and needs to be taken care of with antibiotics, anti-inflammatories, and heat. So that's what I've been doing. I had to call the neurosurgeon and get permission to take the ibuprofen because you're not supposed to have any NSAIDs for 3 months following the surgery. So I did call and they said that it would be okay to take that for 3 or 4 days to try to get this complication under control. They said it did happen because of the IV in my hand, and that can cause this type of problem. So if you end up with any red, painful swelling on your legs or your arms, be aware that that's what it can be, and make sure you go get to see somebody right away. I actually let go for the first few days, had no idea what was wrong, but I just had a sore arm from, I don't know, from trauma of the surgery and stuff. And my husband finally said, you know what, I think this might be a blood clot, so let's go check it out. And we did, and stuff. So it is quite painful. I try not to move my arm a lot, but hopefully it'll get better in the next couple days. And I'm on the antibiotics and the anti-inflammatories. Another issue that happened was, of course, constipation. I actually went 7 days with no bowel movement at all, and then finally broke down and started taking a lot more Senecot and milk of magnesia to try to get things going. Increased my walking a little bit as well, which I can do a lot more comfortably now. And I did finally go some today, but it was a lot of pressure and a lot of straining and very difficult to make it happen. So hopefully it will get easier coming up, and I'll continue to take stuff until things are more regular. But don't panic if it actually does go 7 days. But if it gets to that point, you really need to get more aggressive about getting things happen. But my insides were just still sleeping from the anesthesia, I think. So the rest of the back pain, like I said, is definitely better. Can I tell if the surgery's worked yet? No, I cannot tell at all. I have pain there. It's so similar to the pain I had before, so it's hard to tell if it's from the surgery or from still the previous pain. I do find that when I move, and I used to be able to crack my back and I'd hear a lot of popping sounds, and I can still do that. So I don't know what that means, but it definitely, even right now, just sitting, I'd say I'm probably actually a little more comfortable than I was pre-surgery, especially this time of night, which is when I get a lot of my pain. So I'm real optimistic that this is going to be successful. Definitely the 1 week mark is huge in terms of a reduction in pain. So, know as you're getting there that it will definitely get better. So that's it for now, and I will post again a little bit later when I can give another update. Bye-bye.